Let's see an NCLEX RN video based on care for male patients with reproductive and breast disorders. A patient is started on sildenafil or Viagra for erectile dysfunction. He is concerned that he will suddenly have an erection at work or while playing sports. What should the nurse tell the patient? This medication causes an erection only within 15 minutes of administration. This medication needs to be injected once an erection has begun to occur naturally. Unexpected erections are a side effect that cannot be controlled. The medication does not cause an erection without sexual stimulation. Sildenafil or Viagra does not cause an erection without sexual stimulation. So the last option is the one which we need to tell the patient. A patient is being discharged after receiving brachytherapy for prostate cancer. What is important to include in discharge planning? The use of a condom for 2 weeks post-treatment, increased fluid intake for 2 weeks post-treatment, sterile wound dressing to the affected surgical site, bed rest for 48 hours post-treatment. The patient would need to use a condom for 2 weeks post-treatment to protect his partner from exposure to radiation. The patient has been informed that he has testicular cancer. He is concerned about not being able to start a family someday. What should the nurse's teaching include? Infertility is not associated with testicular cancer treatment. After treatment, he will receive medication for infertility. Before treatment, he should bank his sperm. He should start a family before receiving treatment. Sperm that is banked is still viable, as is not the case with sperm exposed to radiation or chemotherapy. The banked sperm can later be used for artificial insemination. So here the nurse need to teach, before treatment, the patient should bank his sperm. A male patient is diagnosed with ductal carcinoma. Using knowledge of male breast cancer, the nurse would know that which of the following is true. This must be an error because men cannot get this type of breast cancer. This is the most common type of breast cancer in men. This type of breast cancer requires a double mastectomy. This type of breast cancer can be treated with tamoxifen. So here the correct one is, this is the most common type of breast cancer in men. Men who are diagnosed with ductal carcinoma, but it does not require a double mastectomy. Tamoxifen is used with receptor positive tumors. In patients who have been admitted to the medical surgical unit from recovery after a radical prostatectomy secondary to prostate cancer, the patients have an abdominal scar running vertically down the lower abdomen. It is day 2 post-op, and after the initial morning assessment, the nurse contacts the provider because she is concerned about which of the following patients. Mr. X, who has blood-tinged urine in his indwelling catheter. Mr. Y, who complains of chills, nausea and vomiting. Mr. Z, who complains of increased pain at the incision site. And Mr. W, who has no urine output in his catheter. Mr. Y is of concern as he is exhibiting symptoms of infection, but Mr. W is of greater concern because there is no urine output, which may signal a blocked catheter or indications of hypovolemia or renal failure. Blood-tinged urine is normal post-surgery and should eventually clear up, and discomfort at the incision site is normal as it heals. So out of patient Y and W, the most concern is for patient W, who has no urine output in his catheter. Which of the following is true of BPH, benign prostatic hypertrophy? It is a form of metastatic cancer. Benign prostatic hyperplasia is not a form of cancer. Males as young as 25 years old are equally at risk. Benign prostatic hyperplasia is a precursor to testicular cancer. Benign prostatic hyperplasia is an enlarged prostate but not a form of cancer. It is not a form of metastatic cancer or a precursor to testicular cancer. It is more prevalent in older men. So the true statement is benign prostatic hyperplasia is not a form of cancer. The nurse realizes which clinical manifestation is an expected finding of BPH. Increased urinary output, swelling of the penis and scrotum, frequent nocturia, tea-colored urine. Nocturia is an expected finding in patients with BPH due to increased feeling that the patient needs to empty the bladder due to insufficient bladder emptying during the day. Swelling, tea-colored urine or increased output are not common findings. A patient's order includes the placement of a catheter as a temporary treatment of his BPH. The nurse understands the rationale for this intervention is which of the following: exact monitoring of intake and output, retrieving a sterile sample for urinalysis, to evaluate post-residual volume, to facilitate complete emptying of the bladder, to avoid unnecessary surgical procedures. When patients are unable to completely empty their bladder when urinating, they are at a risk of lower and upper urinary tract infection. And it is important to evaluate post-residual volume. Also, post-operatively, in case of transurethral resection of prostate, the catheter is used to ensure the bladder is completely emptied. So the correct options here are to evaluate the post-residual volume and to facilitate complete emptying of the bladder. Patient is complaining of an inability to achieve an erection. The nurse realizes this may be related to a personal medical history of which condition: Crohn's disease, hepatitis C, migraines, diabetes. Diabetes can damage blood vessels or nerves, leading to an inability to achieve an erection. A patient is experiencing erectile dysfunction or ED. He has a history of angina treated with nitroglycerin when necessary. His understanding of his possible medical treatment is indicated by which statement? I guess I am not bad enough yet to need Viagra. I understand Viagra can make my BP higher. Can Viagra increase my chest pain? So I guess Viagra is out of the question because it might drop my BP. Viagra in combination with nitroglycerin can cause a decrease in BP, not an increase in blood pressure or chest pain. So I guess Viagra is out of the question because it might drop my BP is the correct statement. Patient does not understand how he can be diagnosed with late stage prostate cancer because he has never had any difficulty urinating. What is the appropriate answer the nurse may provide? Tumors of the prostate often develop near the edge of the prostate, so they do not interfere with urination. The tumor has already metastasized away from the urethra, so does not interfere with urination. There is interference with urination only when there is underlying urethral stricture. Tumors of the prostate do not interfere with urination in the early stages of the disease. Tumors that develop in the prostate tend to develop on the periphery of the gland, which does not obstruct the flow of urine. A patient is diagnosed with testicular cancer. In educating the patient, nurse realizes that the best treatment is which of the following: watching and waiting to see if the cancer metastasizes, chemotherapy and then rechecks every 6 months, concentrated radiation to the testicle and lymph nodes, removal of the affected testicle. Removal of the affected testicle is performed to keep the cancer from metastasizing and the least harmful to the body as a whole as compared to chemotherapy and radiation. In addition, if the cancer is isolated to the testicle and the testicle is removed, there is not usually a need for further treatment. So here the correct option is the removal of the affected testicle. The nurse understands that neoadjuvant chemotherapy is utilized in which of the following ways? After surgery and insurance against recurrence of the tumor, prior to surgery to help facilitate complete excision of the tumor, prior to surgery as insurance against recurrence of the tumor, after surgery to eliminate any obvious remaining tumor cells. Neoadjuvant chemotherapy is used preoperatively to help shrink the tumor to allow for complete excision. The nurse would question which order of a patient with receptor negative male breast cancer after radical mastectomy. Anti-estrogen therapy per oral, empty drain every 4 hours and PRN, pain medication every 4 hours PRN, instruct on proper self-breast examination. Anti-estrogen therapy is not indicated with receptor negative breast cancer. So here the correct answer is anti-estrogen therapy per oral should be questioned. The emergency department nurse receives a report from a field provider regarding a patient being transported to the hospital after a groin injury sustained during football game. The nurse prepares for which type of trauma? Blunt trauma, deglowing trauma, penetrating trauma, retrograde trauma. Deglowing and penetrating incidents are rare and occur in more severe incidents. Trauma to the testicles from sports injuries are typically blunt trauma. Scott is a 65-year-old male who presents with complaints of difficulty urinating. He complains of pain with urination and occasional blood-tinged urine. He states that he has an increased urgency to urinate and wakes up 3 to 4 times during the night to urinate. He also complains of occasional incontinence. After assessment of his symptoms and education, Scott agrees to a blood draw for prostate-specific antigen (PSA) levels, a urinalysis, and a DRE, that is digital rectal examination. Based on the results of the digital rectal examination and prostate-specific antigen of less than 2 nanogram per ml and urinalysis within normal limit, Scott is told the best intervention at this time is wakeful watching. He is told that if his symptoms worsen, he may be prescribed drug therapy such as 5-alpha reductase inhibitors or alpha-adrenergic blockers. The nurse provides patient education focusing on watchful waiting and the importance of future provider follow-up. Scott's initial complaint is of problems urinating. He is diagnosed with benign prostatic hypertrophy. He understands BPH causes this symptom because the enlarged prostate exhibits which of the following? Often swells when the patient has a full bladder, obstruction to the flow of urine, can easily be injured secondary to blunt trauma, is sensitive to diets high in potassium. The prostate surrounds the urethra and when enlarged can restrict urine flow. The prostate does not swell with the full bladder. It can be injured with blunt trauma, but that is not what causes problems with urination. It is not sensitive to diets high in potassium. So the answer is obstruction to the flow of urine. Scott has been told by his provider that the best approach for his diagnosis of BPH at this time is wakeful watching. The nurse explains that wakeful watching is appropriate because of which of the following. He has minimal symptoms and minimal prostate enlargement. He is too old to require surgical intervention. The provider wants to monitor lymph node involvement. His PSA levels were too high in combination with a negative digital rectal examination. His minimal symptoms do not require more aggressive treatment at this point. Age would not necessarily impact surgery. Lymph node monitoring is indicated if prostate cancer was definitively diagnosed. High PSA levels would call for more monitoring. The nurse recognizes more teaching is necessary by which of the following statements. I guess I need to plan an yearly follow-up. I will call for an appointment if my symptoms get worse. I am glad I'll be able to take my decongestant for my allergies. I am glad medications are not necessary at this point. Decongestants worsen the symptoms. So all of the other statements are correct except I am glad I will be able to take my decongestants for my allergies. Scott is given a prescription for an alpha blocker such as Flomox. He will be educated as to how this medication works. This education will include which of the following statements. The medication relaxes the muscles of the prostate, allowing easier urination. The medication relieves discomfort associated with urination. The medication lowers the PSA levels. The medication dilates the urethra, allowing easier urination. Flomox relaxes the smooth muscles of the prostate. So this is the correct answer and that will allow for easier urination. All the other options are incorrect. Scott is told to report any additional pain, fever, nausea or vomiting to his provider for which of the following reasons. An enlarged prostate can cause a spike in fever. Nausea and vomiting can be related to dilation of the prostate gland. The combination of these symptoms with BPH may be a sign of cancer. Urine stasis from lack of bladder emptying may cause a UTI. Urinary tract infection may occur if the bladder does not completely empty. So that is the correct reason. Hope you understood this video. Thank you so much. Please do keep watching for more videos.